Thank you everyone for logging on, and welcome to today's first DHIN webinar, which is called Cyberpsychology and the Changing Face of Healthcare, presented by Dr. Andrew Campbell and Dr. Brad Ridout. Andrew and Brad are leads at the Cyberpsychology Research Group at the University of Sydney. The group is Australia's first formal research team that investigates the impact of consumer technology on human behaviour. Andrew and Brad are also co-leads of the cyberpsychology node through the DHIN. A resources pack will be sent out at the end of the webinar with full bios and a link to the cyberpsychology research website. My name is Jacqueline Wells and I manage the Digital Health and Informatics Network, which brings you this webinar today. Before we start the presentation, could we please note the following housekeeping information? Andrew and Brad will present their talk and welcome your questions throughout. Please type your questions into the questions box in the GoToWebinar control panel and press send to all. Brad and Andrew will answer your questions at the end of the session. And could I please just check if this is working? If someone wouldn't mind just typing in hello, please, anyone? Yeah, great, thank you very much. At the end of the webinar, a short survey will appear on your computer screen. We very much appreciate the time you spend to complete the survey, as your feedback informs and shapes future events. So thank you very much everyone for logging on, and I will now hand you over to Andrew and Brad to present.
Fantastic. All right. Welcome everybody. This is our first webinar for the Digital Health and Informatics Network. I'll just walk you through a few things quickly. We wanted to start with a thank you to Jacqueline Wells for inviting us to give this inaugural presentation, and to the Digital Health and Informatics Network here at the University of Sydney and Sydney Health Partners for the opportunity to talk about cyberpsychology and its relationship to the work we do in the digital health sphere. Thought we'd start off by telling you a little bit about ourselves. My name is Dr. Andrew Campbell. My background is that I'm a child and adolescent psychologist. Been doing that for about 20 years now, and I started work in the field of cyberpsychology around about 2003, particularly interested in how technology can be used for mental health, specifically around children. And since then, my interests have grown quite broadly into the other spheres of consumer technology, and we're going to talk a lot today about what's off-the-shelf technology and what's clinical technology and leaders in that space. So I'd like to welcome you all today, and before I continue, I'd like to introduce Dr. Brad Ridout.
Thanks, Andrew. So my name's Dr. Brad Ridout. I'm a research fellow at the University of Sydney and deputy chair of the Cyberpsychology Research Group. I'm also a child and adolescent psychologist by trade, interested in all things cyberpsychology, but my main focus at the moment is social media and how we can use it to benefit our health and well-being and mitigate against some of the negative effects that can have on our mental health, but more about that later.
So we want to welcome you all from around the world today. We believe from Jack was briefing us before the webinar, that there was about 120 sign-ups internationally. So thank you very much for joining us. That's a wonderful turnout. We thought we'd start off with a little bit about what is cyberpsychology for those of you who've joined us who are just curious about this field, because we know that there's quite a number of people with us today, both with expert knowledge and introductory knowledge. But we wanted to say that cyberpsychology is a multidisciplinary area of study that is grounded in behavioural science and computer-human factor research methodology. And the interesting factor I wanted to point out was that really the term cyberpsychology is not new. A lot of people say to me when they first hear that this is a field that they think it's a bit of a buzzword, and really it's something that was coined in the 1980s when personal computers entered our homes, and we started to see that it affected human behaviour and how we engage with each other, our work, our time management and our education. So electronic games is another big factor of cyberpsychology, been around a lot longer than the internet, and we're going to talk a little bit about that today as well. It has a vast area of study and application now. We are going to talk specifically today about its effects with medicine, or its impact in the medical field, and e-health in broadest perspectives, as well as psychology. But it's important to know that cyberpsychology is studied within humanities now: economics, law, media, communication, engineering, IT and design, and the health sciences, which is actually where Brad and I work at the focus of health in Australia right now for technological applications online. I wanted to give a little bit of a head nod today to the British Psychological Society and a congratulations to them for being the first organisation to recognise cyberpsychology as a sector of both study and clinical application. Even though it's been around for quite some time, the British Psychological Society now has a focused area on that. They compiled a list of leading interquartile journals or top quartile journals that you can find on Scopus. Apologies for the small print here, which is trying to get them on the slide. There's actually more than this, but these ones have been around for quite some time, and a bit of a nod and a thank you to Professor Brenda Wiederholt, who's with us today, who's the Editor-in-Chief for Cyberpsychology, Behaviour and Social Networking. Fantastic journal, and one that I can highly recommend to get a good grip on the broad areas of applications, particularly clinical applications of cyberpsychology. So let's start into a little foray into the areas of technology we look at for health and well-being. Smartphones is probably the most topical around the world. When we look at the uptake of smartphones over the last only 15 years, we're looking at a population base of well over 4 billion people that own one. Smartphone impact on behaviour was studied nation to nation over the last few years, and the Australian survey found that the distribution of smartphones was actually the highest level of technology consumption in the country. Probably not too surprising. When we look at the amount of time we spend on any piece of technology, smartphones are it. If you click on the link in your own time, we've put in a lot of links today, both to videos and other supplementary information. You'll actually find the details of that survey in 2017. And the University of Sydney is proud to have been a partner in that survey, and it helped in understanding not just people's ownership and consumption of the technology, but how they adapt it to their lives, both for health and wellness. The other one I wanted to talk about, and I'm particularly passionate about the areas of VR and video gaming in particular, is the work by Hope Labs in San Francisco and Seattle. They've been doing work for video games, for serious games, particularly, and in this instance, for cancer in children. They've been looking at ways to actually use video games to educate children about cancer so that they don't feel afraid of the treatments they receive that can make them feel pretty horrible. So in this instance, you've got a character that's actually shrunken down into the body and in a first-person shooter environment learns to destroy white cells. Now, Hope Labs developed this game in 2006. It was trialled in many hospitals around the world, including the University of Chicago. It has been validated several times over, and they have now developed the platform into multi-platform gaming for specific cancers. Before it was just generic. Now they're doing, as you can see in this example here, brain cell cancer fighting, leukemia, bone marrow cancer, the list goes on. Real pioneering work in this field, and I'd say an exemplar of what can be done for video games to teach children about how to recover from challenging illnesses, as well as the psychological side of actually combating pain. That brings us to the other big fields right now in the virtual reality world, the artificial intelligence and wearable technology. I wanted to point out, I mentioned before that Brenda is with us. She is one of the world leaders with Professor Stefan Bouchard in advances in virtual reality for anxiety disorders and also medical areas. The list of work here is quite pronounced and has been around for quite a long time. It's most important to note that the applications of virtual reality now are probably coming to a burgeoning field, because we're seeing that the cost of the technology is coming down. So the personal use of the technology is going up. It's no longer relegated to just labs and specialist technicians. We're looking at applications for generalist training. And I think this is a space to very much keep watch of. Two examples I've pointed out here is we've got pain management for a child who's receiving injections and chemotherapy. And then we also have another child here who is playing a game called Snow World through VR. It's first established with veterans coming back from various wars, and they had to receive very painful burns, skin grafts. And they received a treatment through VR that kept them in a sense of not only distraction, but a physical sense of feeling coolness. And so Snow World's been validated several times over. In the wearable space, I wanted to point out that Samsung, after Google's exploration and foray into Google Glass a few years ago, Google realized it wasn't as successful as they would like it to be. Samsung is now picking it up and trying to look at ways in which the technology can interface better for work as well as leisure, but be a little bit more of an easy interface. So they've actually developed the new type of glass there, Visor, and Wearable technology, nothing new, but in this space here, what we're looking at is wearable digital health technology that actually can bring on more information to make people aware of psychological symptoms and or physiological symptoms for neurology. In this instance, we can actually measure beta waves and theta waves, and this can be an early onset warning for epilepsy and seizures, stroke, as well as panic attacks. So this space of wearables and how to use this data for staving off serious medical conditions or psychological conditions is very much a growing space. The last part I wanted to point down to here is this table here, and this is actually a basis now for where AI is already in use in medicine. Diagnosis, and this is from an adjunct point of view, not a sole point of view, is being used to validate clinician decision making. Treatment suggestions, predictions and record management, and assistance during surgery. The AI space is growing rapidly, but the areas that in cyberpsychology is particularly interested in is not just the interface of using AI and being able to personalize it per patient, but the record keeping and the data mass building of how to actually access records globally and cross-culturally. I'm going to hand over now to Brad, who's going to talk a little bit more on the youth focus, which is a big area of what we do here at Sydney Uni. And then we're going to come back and talk a little bit about the work we're actually carrying out at the moment. Over to you, Brad.
Thanks, Andrew. So these figures come from various national surveys conducted by Deloitte, the ABC, Royal Children's Hospital Melbourne, among others. And they look into how we use digital devices, how we feel about them, and the self-perceived impact they're having on our well-being. So the reports go into large amounts of user detail and trends across the lifespan, but as Andrew said, we're going to focus on young people 25 years and under. So let's start with preschoolers. A survey of parents found that 85% of parents reported using screens to occupy their kids under 6 to get things done, and 1 in 4 did so every day. It should be noted that this figure includes television, which has been used as a pacifier by parents for decades. So perhaps the more concerning figure is that 50% of toddlers and preschoolers use digital devices such as smartphones and tablets on their own without parental supervision. While there's not necessarily anything horribly wrong with doing this every now and then, as anyone with children will know, it's sometimes a must. But we know that children benefit most from the educational potential of devices when co-viewing with a parent who can help them relate what they see on screen to real life and support their language skills. And there's a lot of research going on at the moment to establish an evidence base for a lot of the learning activities we see on tablets aimed at kids, many of which, unfortunately don't have an evidence base behind them. So the current recommendation is for no screens at all for under 2s. An image that's always stuck in my head is seeing a toddler pick up a magazine and then try to swipe the pictures from right to left like it was a screen, and then looking puzzled when the images didn't change. Almost half of children regularly use digital devices at bedtime. As many of you will know, blue light emitted from screens suppresses the production of the sleep-inducing hormone melatonin, making it harder to fall asleep. And reduced sleep quality can obviously affect concentration, academic performance, as well as mental, emotional and physical health. Smartphones and tablets aren't the only digital devices that are ubiquitous in today's family. 97% of households with children have at least one video game device, and 8 out of 10 have multiple devices. Encouragingly, almost half of parents surveyed play video games with their kids, with reasons for playing together including family enjoyment, education, and as a way to monitor what their children are playing. And contrary to the stereotype, video gamers are not just boys glued to a screen sitting alone in a dark room. Females now account for 46% of gamers, and most people play games with others rather than alone, often online, but often in person as well. And video games are now played by just about all sections of society, with the biggest growth actually seen in the over 65s bracket. So much of the recent research in Australia on digital device use centred around smartphones, as Andrew mentioned, with the latest figures showing that over 90% of Australian teenagers now have their own smartphone, a rate that's been rising steadily over the past few years after a massive increase from 25% to 80% in the 4 years from 2011 to 2015. 63% of under 25s report spending 3 or more hours a day on their smartphone, and over half check their phone at least every 30 minutes. However, research conducted here and in the UK suggests that people tend to underestimate how much they use their phone by about half. So this figure is likely to be even higher. Having said that, what is surprising to some is the level of insight that young people actually have into their smartphone use, with 53% considering their phone distracting and 2/3 of young people admitting to using their phone too much. However, this doesn't mean that they are motivated to change their habits, with 48% of young people saying that living without their phone would be intolerable. As you may have seen in the news recently, Apple and Google are introducing new features for iPhones and Androids respectively, to help young people and older people track how much and how they're using their devices. There's been apps available for this in the past, but it's now a part of the actual phone interface. So this has been in response to public pressure to cure the disease that they've caused, so to speak. So while these features are a welcome addition and a step in the right direction, many experts doubt that these features are going to be effective, especially for young people who are unlikely to be motivated to police their own behaviour, nor respond well to parents putting blocks on the use of certain apps beyond a prescribed time limit, which is what it's going to allow. 2/3 of parents already report family conflict as a result of screen use. Research has shown for some time that social media is a key part of social and identity development for millennials in particular. The reports justify this further by showing it to be the most important function for under 25s, closely followed by texting and direct messaging applications, which reiterates what an integral part digital devices play in the social lives of today's youth. Australians are in fact among the world's most prolific users of social media, and young people are the most active group when it comes to creating and viewing social media content. While Facebook still remains the platform of choice for most adults, teens have been moving away from Facebook in recent years, partly because it's becoming overpopulated by parents and grandparents now. Australian teens have been spending more time on more image-focused social media platforms such as Snapchat and Instagram, and this is consistent with patterns observed across the world. 20% of Australian youth reported that they were cyberbullied or perpetrated cyberbullying online by either being the antagonist or a contributor. Additionally, 61% of Australian parents reported concerns about their children's use of devices, including cyberbullying. So parents report also being concerned about the kind of content their kids access and contribute to, along with how long they're spending on their devices. One of the most frequent questions we get asked by parents and in the media is how much screen time is too much for kids. And the truth is there is no one-size-fits-all answer. Given how much kids rely on technology for their education and social life and the benefits they get from it, it's actually much more important to consider how kids are using their time on screens rather than simply the number of raw minutes or hours. And screen time is actually an outdated and overly simplistic concept. It was actually designed around television and then just hopped across to digital devices without much thought. So we encourage parents to go a bit deeper and take a more nuanced approach using the framework of digital nutrition developed by our colleague Jocelyn Brewer, which focuses on having a healthy relationship with technology and being mindful about how we use it.
Yeah, look, I think all these points are highlighting just how much psychology is permeating into understanding human behaviour's use of technology. So it's a dual relationship of not just studying the technology itself, but studying human behaviour's use of the technology. And this brings us to where digital health and cyberpsychology research is flourishing at present. Given the societal shift from reducing tech use to embracing its potential, we very much don't want the area, and I think most people that are tuned in today feel the same way, to be a sensationalized area of panic. Technology should be an adjunct tool to help us live our lives the best way we can. So the following is what we've got as some areas of research that we're doing at Sydney University to tap into the power of technology to help support mental health and physical health. And we're very proud of some of these. Some of them we haven't shown before, and so we're going to direct you to some videos to look at as well. I'm going to hand back to Brad. This is Brad's own work, which has been published quite highly in Drug and Alcohol, and it's I think it still is the world first on the use of how to reduce binge drinking using social media and social norms. So I'll hand back to Brad.
Thanks, Andrew. Yeah, so this was the focus of my PhD study at the University of Sydney. When I was starting out as a researcher, Facebook was really starting to take off, and I became fascinated with the way that young people were using social media to construct their identity and present it to their peers in the wider world. Until then, research in this area had focused mainly on older adults and how they were using online dating websites, in which they would often post outright lies about themselves along with decade-old photos. In contrast to this, for the most part, relationships on social media are what we call anchored in actual offline relationships. So adolescence has obviously always been a time of identity exploration. However, sites like Facebook were altering the traditional ways in which young people explore and construct their identity, giving them unprecedented control over how they present their image, their likes and dislikes, and articulate and quantify their social connections and relationships in a way that wasn't possible before. So after analysing the Facebook profiles of 150 university students, we found that there was a high prevalence of alcohol-related content in the form of photos, comments, liking of alcohol brands and memes, suggesting that while today's young people are actually drinking less than previous generation, being portrayed as a heavy drinker is still a socially desirable component of the online identity of many young people. And when we quantified this, we found that it was predictive of alcohol-related problem behaviours. So it's been known for a long time that peer influence is one of the leading motivators for young people to drink, and one of the strongest determinants of alcohol use in adolescence is normative beliefs about how much everyone else drinks. So it's an established body of literature from the US and Australia. It's shown that young people tend to overestimate how much and how often their peers drink. And we now know that social media is contributing to the normalisation of this binge drinking culture, perpetuating a vicious cycle in which young people feel pressure to drink up to these misperceived norms that they see on social media on a daily basis. So we sought to harness the influential power of social media as a medium to deliver a social norms intervention. So we took a group of students who were identified as risky drinkers and used Facebook to engage with them, comparing their individual drinking habits to those of their actual classmates and pointing out incorrect assumptions about their peer drinking levels. Those who received this personalised feedback halved their drinking from on average 40 to 20 drinks per month, which was a really exciting result, especially given it was maintained up to 3 months later. So this demonstrates the potential for researchers and policymakers to use social media to influence positive health behaviour change. We're seeing this in other areas of health now. So the next step is to harness young people's own social media activities to influence their peers rather than those directed by clinicians. And groups like Hello Sunday Morning are currently working to build an evidence base to show how organic peer-to-peer interactions on social media can help reduce not only an individual's drinking, but change the way they and their friends think about alcohol, which are obviously both important steps to reshaping cultures of drinking in Australia.
Right, so the Cyberpsychology Research Group here at Sydney Uni, we're very lucky to have been partnered with an amazing organisation called Kids Helpline. They're a national organisation, not-for-profit, that actually aids in connecting young people to help at any time of the day or night, and that means they speak to a counsellor, a trained counsellor, 24/7 through a phone number or through the web. What they wanted to do, and they approached me some years ago, was to develop a social network that was about mental health and shared experience, and they wanted it to encourage anonymity so that the people would actually be able to speak not just peer-to-peer with someone going through the same experience, but with a counsellor facilitating. So what we did is we worked out how to do this with using youth mental health issues that were quite prevalent. So we started looking at things to do with family discord, depression, anxiety, bullying, and so on. What we found is that they very much wanted this service, but they were turning in first to other social media platforms that were not controlled, weren't as safe. So Facebook groups and things like that. So Kids Helpline Circles was developed, responded to the need for safe and anonymous online environment for connecting with peers and professionals for support. We used a group counselling model that was to start with small groups of lived experience at the same age. So a group of 14-year-olds all going through depression or bullying at school would meet together online. They'd be given pseudonyms by the service. They can create a social network profile and work with a counsellor as a group counsellor. So it connects with all with similar age, similar problems. The counsellor service is what's the most unique part, is that we've been working with them on the modules that they need to work with different problems, and now we're expanding the service. We'll just press the next one. It's moved to the mobile platform, and this is sort of like a little picture of what a young person sees. Very familiar to them. It's very similar to interfacing with most other social media platforms, but it is purpose-built, designed, and data safe. In other words, Kids Helpline control the service and maintain the education. We've got lots of different modules we've built now for improved coping skills, reduced feelings of stigma, and these are administered through counselling services, and as well as risk management. So if a person in the group has suicidal thoughts and so on, there's a counsellor present that can actually get in contact with them anywhere in the country and get them to services. We invite you to have a look at the YouTube clip, which was really only produced about a week ago, I think, from Kids Helpline to demonstrate where we're at now in the rollout of these services. With big thanks to Kids Helpline for the development of the video, and to FGX, which has been our funding body behind this.
Okay, so to conclude, the interesting thing about studying technology and its impact on health and well-being is, as researchers and professionals, we can sometimes become overly focused on the technology being used, see it as the source of the problem, or alternatively the silver bullet to fix it. By this I mean we tend to forget the sociological and psychological factors at play. So the internet in particular is basically just a magnifying glass for human behaviours that have always existed. So what we've previously done offline, we can now do online, quicker and with wider reach, but far less culpability, as we see with cyberbullying. So you need to remember, it's like technology is but a tool, but we need to remember to address the traditional factors of health and mental health as much as we investigate the tech products themselves.
Yeah, as researchers, we all have a responsibility to upskill our knowledge, both in our areas and disciplines. So in psychology, you'll do clinical professional development. In medicine, no doubt you do exactly the same thing, and many other areas have upskilling programs. But upskilling our technology skills for our work is something that is slated for us to do, but often we put off. It's important now that we see it as a skill set that's important as our clinical skill set, as well as our research skill set, so we can better inform the public on how to manage health and wellness in our areas a lot better. So just because a treatment works offline, as well as something that we've got to start adjusting our attitude to over the last 10, 15 years, particularly in the space of e-mental health, we've had a lot of great headway moving ahead in online treatment programs, particularly in Australia. We've had a great deal of success with people like Professor Helen Christensen developing Mood Gym, Compass, and many other tools that are now coming out of Blue Pages. But what I would say is that we can't just do like for like. You know, doing one therapy offline doesn't necessarily translate well online. And we even found that with KHL Circles, that we found that group therapy offline does not translate well online. So we've found different ways to develop group therapy online. So it's important that we are effective in evidence-based testing technology with therapies and not just assume that it's a like-for-like fit. And that's something that cyber psychologists do quite well. And we're hoping at the end of this webinar that you reach out and contact us if you see a benefit for us to talk to you about how we can do user-based testing and make particular treatments or therapies accessible to individuals, not just the masses.
Yeah, so as Andrew was saying, very few of the apps that we see out there have a robust evidence base behind them, and as I said earlier, or a scientific basis at all. And this is where the fields of digital health and cyber psychology will probably bring the most benefit to society, ensuring that digital tools for health are safe and effective, especially for young people. So one of the leaders in this field, Professor Helen Christensen.
I stole your line, didn't I?
Sorry. We're a bit of a fan. She suggested that we need a statutory body to authenticate the claims made by apps and digital tools in the same way that the Therapeutic Goods Administration does for medicines and supplements. So this would ensure that only tools that meet a prescribed standard for safety and effectiveness would be accepted for dissemination. It would also discourage app designers from rushing out their products, which typically happens now, and most importantly, making sure they don't do any harm. So yeah, so should be kept in mind that even the most reputable digital tools cannot replace professional help, as I'm sure you'll all agree. They perhaps best conceptualised as just that, tools, to make the delivery of healthcare more effective and efficient and help us reach wider populations. Yeah, as we like to say, for what we consider digital health now, we'll probably simply refer to one day simply as health.
Yeah, look, that wraps up our first webinar. We very much encourage you to have a good read of our website, look at our films up there. There'll be a few other videos going up shortly, but there's a nice film up there on what we do at Sydney Uni. We've got a list of all our research and outputs. And of course, the best way to keep up to date with us is through Twitter. So there's our individual Twitter addresses and our Cyberpsychology broad group address, which contains all our other members. We've got about 8 or 9 different members. And we very much look forward to taking your questions. Thank you for joining us.
We do have a couple of questions. The first one is from Erin. Hi there, could you tell us a bit more on what the uptake for the KHL project has been like so far for users, and do you have a critical user mass in mind?
Yes, the uptake so far, it's been running now as a beta test for nearly 18 months. Yeah. So in that time, we've had 70 or 80 users trial the program to make sure that A, it's safe, B, that it's usable, C, that they actually can see benefit to staying with the program and continue building in the community. We're now in the second phase where we've actually changed the platform a little bit to be a lot more mobile friendly, and we have another 45 going through a cycle right now. So they do group counselling for a period of 6 to 8 weeks, and then after that they're going to be released. We kind of call it a catch and release program. They start in a small group, and then once they finish the group, they can go into the wider social network sphere and work with other kids with different experiences and still be monitored by a counsellor. The upper group, we have a very rough figure of what we're talking about as a full-on use number, and that is based on the counsellors that we can have working on it. The knock-around figure at the moment is 50,000 young people between 13 to 25. So essentially, the CEO, Tracy Adams, said to me once, look, we could see that this is going to be quite successful, but we don't want to reinvent Facebook for mental health. But at the same time, we do want to have a unique platform that makes people feel valued, that they can return to at any time between the ages of 13 and 25 and take up the group counselling option for free. So that's the rough target at the moment.
We've got another question from Matthew. How important is engagement in digital health, and how do you find engagement in your projects related to health outcomes?
Do you want me to answer it? So the first part of the question was how important
is engagement?
Extremely important. You know, we're always looking for people for research projects, but to be honest, what we do to garnish the understanding of people's use is looking at tech uptake. So this is where cyberpsychology is quite innovative, that we look at what people are already using in their lives, and then we unpack what benefits are there and what is not, because a lot of the companies themselves produce a particular technology without understanding that it may have long-lasting effects. The hottest topic on that one would be video games. You know, what is the impact of a particular type of video game? Fortnite's been talked about in positive and negative ways, as did Pokemon Go last year and Angry Birds the year before that, and the list goes on. Sorry, the second part of the question?
How do you find engagement in your projects related to health outcomes?
Engagement has been very good, particularly through the Kids Helpline one. That's a longitudinal one, so we've been following them up at certain week stages. In fact, I think we're over following them at one point. So the engagement is good. Our dropout rate is very typical to most studies. The funny thing is I think the engagement comes down to their own usability interests. So as long as they're already using the platform, they're very happy to usually be a part of questioning of what they like and what they don't like about
We've got a question here from Doug. The digital age pushes a 24/7 expectation of availability. Has this been an issue for moderated forums, etc., people wanting services available outside the 8 to 5 work life?
Yeah, absolutely. And this is, precisely what the Kids Helpline Circles project is trying to address. So, the aim is to have a counsellor 24/7 available on the service. They have that currently with their phone and web chat. And it's going to be.
It definitely is a consumer expectation. By no means meant to cut you off there, but yeah. So consumers, the digital world is 24/7. You know, that we're already living in that world. So access to services, be they health or mental health, is a natural demand. Therefore, the issue is resourcing. And so we're not finding tremendous problems with the technology other than accounting for privacy, usability, flexibility, and adaptability to regions. So, I mean, they're all things we've got to take into account, but the accessibility to someone anytime, anywhere, which is actually now the motto of your town, which runs Kids Helpline, is very important. So, and I think that's what we're starting to see, is that the health sector and the mental health sector needs to address outside clinic hours, and this could be a cost-effective way of doing it. But I think we probably need to address that to a health economist more than ourselves.
We've got another question from Erin. Is network analysis common when researching online peer-to-peer mental health communities, i.e. how they start, what users do, day-to-day content they engage with?
From my knowledge, there's quite a number of studies that have been done on peer-to-peer support, but in the tracking of what they do day-to-day outside of what they post, no. So looking at digital diaries and narrative tracking or geolocation, things like that, these are all very new things. And what is holding it back is not so much the fact that it can't be done on a physical level or a methodological level, but the ethics of it. So that's the biggest thing. And the thing that we, in particular, we work with youth, we cannot do that sort of level of tracking. So ultimately it's volunteerism, and some of the studies that have been done with a little bit more detail are very small. So it's very much like asking somebody to be in Big Brother. You know, I don't know if somebody would want to be tracked that much. Having said that, the data would be very valuable for us to see what support services they need on and offline.
I had a question. You mentioned before that the video gaming is going up in the over 65 bracket. Do we have any idea about why that might be?
I think it's definitely related to the uptake of smartphone use by older people. They're using it as a way to keep in touch with their grandchildren, and you know, they're a lot more tech savvy than previous older generations. And yeah, it's something that's probably always been a bit kind of out there and scary and unknown to them, and now, you know, it's something that's
they're trying it.
Yeah, it's in their pocket, and it's quite simple, and
it's a great social connection across ages. And I mean, the latest stats on video game use worldwide is 2.6 billion users. You know, they're not all youth. So I agree with Brad. I think that the over 65 group, well, I don't know it as well. I think they're probably connecting through the social aspect of gaming.
Yeah, things like Words with Friends and kind of, you know, games like that, which you probably wouldn't necessarily think of when you think of video games. Something that, you know, older people are very much engaged with these days.
And sorry, Erin said, sorry, I didn't mean outside the platform tracking, I meant inside the platform tracking.
Oh, inside the The answer is yes. Yes, there is lots of studies that do inside the platform tracking. So, for example, this is sort of stepping more towards information architecture design. There's a lot of user experience design of what people are looking at, how many times they access something, what they're trying to find, searchability. There's a lot more going on about that now. To be honest, the early iterations of self-help platforms, whether it be a discussion board or online counselling, were a case of whack up a website and see how you navigate it. There's a lot more artistry and a lot more methodology that's going into that now, that's coming from human computing aspects, that's also blending into what's good for a person that's distressed. So, you know, you may have heard a term called the 3-click rule. If a young person doesn't get to something within 3 clicks, they may disengage from that technology. So tracking how they use that technology is as important as the therapy they're getting from that technology.
We've got another question from Matthew. He says, what is the incentive, do you think, for tech companies like Apple to start limiting screen time via this integrated app?
We've probably only got opinions on that one, but
yeah. Well, at the end of the day, Apple and Samsung are in a great position where by the time you're using the phone, they've sold it to you. They don't make any money per se from the amount that you're using it. That's more the software domain. So, and yeah, it's all about how people feel about their phones. You know, in the first few years, it's, you know, people were just amazed by them. You know, the best things since sliced bread. Whereas most of the media we see these days around smartphones, it's all bad press. So I think this is definitely, you know, from a PR perspective, something that's definitely they've got to get on board with, because, you know, if they want us to use them and see them as something useful in their lives, and rather than a distraction and something that harms their mental health. Putting the information in their hands is one step towards you know, allowing people to be able to, you know, have a healthier relationship with the technology, because that's what's going to you know, drive their long-term success.
I have a brief comment on that, is that I think that Samsung and Apple and any phone company that's interested in developing health, particularly, I mean, it's something that's common to all of us. Economically, it's smart. Socially, it's going to be something that already people are doing, because we look at comparing our exercise fitness through social media and things like that. But doing things that limit people on a phone, so that the software about, you know, we're going to tell you how much time you spend on your phone, that can be interesting, but understanding people's motivation for not adhering to that information. You know, you've been told you've been on your phone for 2 hours in the day, now switch it off, but you don't. It can create sometimes problems. People might feel guilty, they might feel like I'm unhealthy. You need to not just give information, you need to put the information in context. And that's where I think these companies need a little bit more cyber psychology. They need to research a little bit more about what that information does to human beings.
Does anyone have any more questions? I think that might be our last one. Did you want to add anything, Andrew?
Oh, right. Look, I just want to say again, thank you very much for having us, Jack, and to the Digital Health and Informatics Network. And we invite emails, tweets, contacts, direct messaging, social media, and any other form of carrier pigeon you'd like to send to us to keep up the conversation. So thank you very much for joining us today, Brad.
Thank you.
Yeah, thank you.
Thanks, Jack.
So I just wanted to say a massive thank you to Brad and Andrew for today. This was the first DHIN webinar, and I think we've started with a really, really great one. Cyber psychology is a node within the DHIN, and we encourage you all to sign up to it if you are interested in knowing more about what was covered today. We send out communications about once a month, and we know that there are a few really interesting things happening next year in this space as well, so we'll let you know all about them. I've included a link to DHIN and the Cyber Psychology Research Group on this last slide, and we will send you around all the resources, and also we filmed this today, so we will send a link to the recording in the next 48 hours. So thank you to everyone for logging on today, and hope you have a lovely day.
Thanks.
Thank you.
Thank you.
Done. Well,